It's a common misconception that most Aboriginal and Torres Strait Islander people live in rural and remote communities and areas of Australia. In fact, 79% of our mob live in urban areas, with 41% living in major urban cities. In Queensland, 38% of Aboriginal and Torres Strait Islander people live in the South East region. That's currently 65,000 people.
Another misconception is that Aboriginal and Torres Strait Islander people living in urban areas have easy access to healthcare. This is not the case, with an 11.6-year gap in health-adjusted life expectancy in urban areas. Access barriers include things like lack of cultural safety, cost, and the availability of transport.
South East Queensland is home to the fastest growing Aboriginal and Torres Strait Islander population in Australia, projected to grow to 130,000 by 2031.
To improve healthcare access and health outcomes for this ever-growing and increasingly dispersed population required a major rethink. So in 2009, the 4 South East Queensland community-controlled health services joined together to form the Institute for Urban Indigenous Health.
With a clear vision to create healthy, strong, vibrant Aboriginal and Torres Strait Islander children, families and communities, and with a mandate from our 4 founding member services, the Institute aims to improve family wellness through integrated health and social support services.
First, we worked out where in South East Queensland people were living and mapped out service delivery and access across the region.
From this, the Institute's model of care was developed, and the first Moreton ATSICHS clinic was established. Over time, the model of care has developed into a comprehensive system.
The system of care provides us with the structure and tools to respond to the health needs of our mob. The system of care is underpinned by our cultural integrity framework.
Known as The Ways, the framework acts as a cultural and philosophical worldview which informs and guides our actions as a sector and as a community. The Ways statement guides how we work, how we orientate our processes, and what inspires our directions. It is the foundation on which we base all that we do. It provides clarity and conviction in our vision for strong and deadly families and communities.
The Ways constantly reminds us of the need to operate in a relational framework, that our connectivity is our strength, and that we have cultural obligation emphasising our accountability to our people.
Fundamental to our ways is respect. Respect for each other, respect for where we have come from, and staunch determination for where we are going.
Across the region, the Institute is governed by the Aboriginal and Torres Strait Islander Community Health Service Brisbane,
the Kalwun Development Corporation,
the Kambu Medical Service,
and the Yulu Burri Ba Health Service.
To support this, a new governance structure was established, with the Institute being led by a board representing its 4 founding members.
And supported by 4 independent directors with medical, legal, financial and governance expertise, working under a modern constitution collaboratively across South East Queensland. This enables a more efficient financial model, optimisation of revenue and, in turn, a reduced dependency on grants. Generating our own funds enables the Institute to more easily address service gaps and respond to community-driven needs.
A structured clinical governance framework is embedded into all processes for governing boards, management and staff, with a standardised toolkit for monitoring clinical quality and safety and ensuring we're accountable to our people.
At the heart of the Institute is a dedicated and ever-expanding workforce who are guided and supported by a clear strategy that focuses on developing skills, building capacity and optimising staff configurations to consistently meet service needs.
Streamlining the family experience and contributing towards improved access is the Institute's single electronic health information system. In use across the majority of services, it enables effective, efficient delivery of healthcare and the opportunity to apply data to identify health trends within the region's Aboriginal and Torres Strait Islander population.
Data collection and monitoring is also used extensively by the team at the Institute to inform evidence-based strategies, helping to stay ahead of issues such as population growth and movement, keep up with demand for growth in service delivery, making sure we are continuously improving the services we provide for our communities, and measuring client outcomes such as service accessibility across the lifespan from our old people to our babies.
Meaningful community engagement helps us to remain accountable to our people and connect our mob to services and programs. Some of the ways we engage with our community are through our Deadly Choices programs and community days, which are positive vehicles for how we yarn with our mob around deadly lifestyle choices.
And through our Yarn It Up project, where we go out to connect with our community members to find out their needs and how we can best address them. It's a way for our mob to share their thoughts, feelings and experiences about our services and about their needs and aspirations.
In keeping with Aboriginal and Torres Strait Islander culture, caring for the well-being of family is at the centre of all of our efforts, from conception and infancy through to elderhood. Our multi-generational approach considers the healthcare needs of individuals and families and the broader ecosystem we live in.
Health inequality is heavily influenced by factors outside the health system, social determinants such as adequate housing, education and employment,
as well as less tangible factors such as discrimination, racism, social exclusion, stress and exposure to violence.
Have a major impact on health outcomes. The Institute is supporting communities in the region by specifically targeting these determinants through early childhood education and kindy programs, access to legal advocacy and support, and building opportunities for cultural connection and social participation.
We're also really proud of our workforce strategy, which provides training and employment opportunities to build a skilled Aboriginal and Torres Strait Islander workforce, at the same time addressing those key determinants of health: education, employment and household income.
We reduce access barriers by creating affordability with no or low-cost services. With access as a strategic priority, the Institute has expanded its offering to encompass an integrated, one-stop shop approach to our clinics, where services such as adult and paediatric allied health services, podiatry, occupational therapy, physio, audiology,
oral health care, family wellbeing services, community aged care services,
maternity services and specialist care are co-located in a single familiar caring environment. In turn, this overcomes access barriers to services and enables more seamless integrated care while fostering a sustainable and efficient business model.
We deliberately locate clinics in close proximity to where our mob live and support them through a comprehensive client journey.
With an expansion from 5 to 20 clinics, the Institute has significantly increased clinic access from 8,000 to 35,000 clients in 8 years.
And, in the same period of time, has also increased annual health checks from 500 to 20,000.
Health outcomes are dramatically improving too, with lowering of preterm birth rates to 6%. That's half the national rate of 13%.
And we've been closing the health-adjusted life expectancy gap 0.7 years over the past 4 years. That's 1.75 times faster than standard care.
Under the guidance and governance of the WAYS, we've developed a highly effective system of care, well positioned within a broader health and social support ecosystem.
There are no wrong doors at Aboriginal and Torres Strait Islander community-controlled health services in South East Queensland.
Only meaningful, culturally responsive services, connections and pathways leading to improved outcomes
and better lives for Aboriginal and Torres Strait Islander people.